Medical assisted suicide.
My name is Christina Selch, and I am going to introduce the ethical dilemma that my group has chosen. We have decided to talk about assisted suicide. This is an issue that is becoming more and more prevalent in the healthcare field. Recently, in the state of Washington, the number of assisted suicides grew 40% in just 1 year. So this is something that is not just coming into play in the state of Washington, but also spreading across the entire United States, and is something that people do have two very strong viewpoints on. Assisted suicide can come from a person of any age who has maybe been diagnosed with a terminal illness and is looking for a way to end their life in a peaceful manner. It can be an elderly person who is trying to take away the burden that they feel they may be to their family member as they continue to age and encounter more health issues. And people who are looking for this are looking for a way to end their life in a peaceful manner, a manner where maybe they can pass in the comforts of their own home or in the safety of a hospital, but also be surrounded by loved ones and not have a traumatic passing, which will benefit maybe the family and the person as well. They can have a peace of mind about that. So there are two very strong viewpoints on this subject, and my partners in the class, Jennifer and Jennifer, will be discussing each side of that. So we will explore both issues with assisted suicide.
For medical assisted suicide.
Hi, my name is Jennifer, and I would like to talk to you about medical assisted suicide. Physician assisted suicide occurs when a physician helps facilitate a patient's death. With that said, a patient needs to have a terminal illness that is incompatible of life. When the physician helps that patient have assisted suicide, the physician either offers them a cocktail, a drug that can end their own life, but the physician is completely aware. There are 4 different states in the United States that has gone to death by dignity. Those states are Oregon, Washington, Vermont, and Montana. According to Oregon's state laws, the patient is eligible if they are 18 years of age, they have to be a resident of Oregon, they have to make sure they attend a physician that will allow them to have this assisted suicide. They also have to have a terminal illness that is incompatible of life within 6 months for them to die. The patient will be given a legal dose, a prescription, but not only do the patient have to have the legal dose, the patient must request it twice before the patient can be able to give that prescription, be able to have that prescription for the dose. Since Oregon's Death by Dignity Act was passed in 1994, a total of 1,050 people had received a prescription and was written, and 673 patients have died from ingested medications from that prescription. Washington State is very similar of Oregon. The same requirements have applied, except for the patient needs to have 2 physicians to be able to be examined, and if one physician feels deemed that the patient is unable to uphold, then the physician may order the patient to have a psychological exam. Vermont has similar aspects and laws just like Washington does. There are organizations that are out there to support assisted suicide: Compassion of Choice, Dignity Dignity with Death National Center, Dignity in Dying, Exit, Final Exit Network, World Federation of Right to Die societies. The opinion of assisted physician suicide can be very vague. Some patients think that a physician is nothing but a healer, but a physician wants to heal the pain as well. Physicians don't want to see that patient in pain. By providing assisted suicide to the patients, this can offer them a plan that they can die with dignity without having their family members suffer along with the patient.
Against assisted suicide.
There are several arguments against assisted suicide. The first being that the safeguards and the laws that are in place with this option are too vague. First being 6 months or less to live. Just because a doctor, or two doctors for that matter, agree and come to the conclusion that your illness is terminal within 6 months does not mean that that is true. They cannot predict that to much accuracy. Granted, they might be able to look in the past and see what has happened to other patients with that diagnosis, but in every case, they would be able to find a place where somebody has lived longer than 6 months with that same diagnosis. The second being the safeguard of a 2-week wait and making 2 separate requests. Now, with this, if somebody has just learned that they have a terminal illness, then they are going to go through a grieving period. Now, with this grieving period, that is saying that they're going to have a sound mind in 2 weeks after learning of this and discussing it with their family is just not practical. If you have 2 weeks to make a decision whether you want to have an assisted suicide, then at this point, that's just not enough time to have counseling, to have the support of your family, and to have everybody come to the realization of what's happening. Secondly, our technology, all of the antibiotics, all of the treatments, all of the chemotherapies, all of the radiation therapy that we have available to us today is increasing every week. There is a new technology that is available. And because of this, who's to say that if you had a terminal illness today, and if you underwent treatment today and continued that treatment, that you would be able to live longer than 6 months, perhaps even several years, and have a good quality of life. Granted, it may not be that way in the long run, but saying 6 months and then ending your life at that point is just not valid. The second one is all of the alternatives that we have right now to pain management, disease management, and comfort. Now, with this being said, it might be, from somebody's perspective, more comfortable for their family not to have to deal with that as far as seeing their family member suffer. But on the same side, does that mean that that person should take it upon themselves to request an assisted suicide? Either way you look at it, from any point of view, having an assisted suicide be law is just not valid and has too many flaws at this point in our society to make it a law.